Hey everyone, it's Kristen from your Wellness Center. Today I'm going to give you some tips on how to space out your aesthetic treatments. At our MedSpa, when you come in for a skincare consult, we assess your skin and really figure out what your goals are and what we can do to help you reach those goals. Oftentimes, we have to be a little bit more aggressive in that initial period to get your skin where you want it to be. And then ideally, we get you into a point where it's more of a maintenance mode and we have you doing treatments a little bit less often to maintain those results. Keep in mind as we move forward and talk about the different treatment options that the schedules I'll be talking about are more geared towards that aggressive treatment option at the beginning. And then we will talk about an ideal maintenance schedule. Let's first talk about Hydrafacials. A Hydrafacial is a great option for any patient. Ideally, every 4 weeks would be a great schedule to get on. I like to tell my female patients that if they notice there's a certain time throughout their cycle that they're more prone to acne, to schedule the Hydrafacial about 3 or 4 days before that anticipated breakout to hopefully help minimize the severity of it. Now let's talk about microneedling and chemical peels. These are great summertime treatments because it's okay if you have a light tan. Typically, I like to schedule these 4 to 6 weeks apart. Reason being is I want your skin to have time to heal before the next treatment option. Let's talk about Bbl and Halo. These treatment options are perfect for late fall, winter, and early spring because we cannot have an active tan on our skin. The reason is the light and the laser are going after pigment, and so we don't want to negatively affect the treatment. Consults are extremely important for these two services because we need to make sure you're an appropriate candidate. We can pair these treatments together on the same day if you're eligible. We can also space them out, BBL treatments specifically, anywhere from 1 to 4 weeks. Halo, we typically space a little bit longer. Sometimes that's a once a year treatment for a patient. It really depends on how your skin looks and what your skincare goals are. Finally, let's talk about injectables, which include Botox, Dysport, and filler. For Botox and Dysport, those are typically spaced out every 3 to 4 months. It just depends on how your body metabolizes the medication and how often you need to come. Most filler lasts 6 to 12 months. So for example, patients who are seeing with lip filler, typically we'll see them about once a year. Ideally, once you reach a point with your skin where you are happy, you have met your goals, we want to maintain those results. A good schedule to get on once you're in that maintenance period is going to be seeing us quarterly. That can be for injections. Oftentimes, if you're getting Botox or Dysport, that's going to be a treatment that's every 3 to 4 months for most people. If you're somebody who's getting filler, that could be something you're getting every 6 to 12 months, and you can kind of time that out so you're not seeing us all the time. Pair those treatments together. Use those appointment times to plan other treatment options. So once we get into that maintenance mode, I'll usually tell people every 6 months, do some sort of medical grade treatment. That could be BBL, that could be Halo, microneedling, a chemical peel. On those other two appointment times, maybe that's when you're getting filler, or if you want to do another treatment option and do something quarterly, that's a great way to go. And then you can sprinkle in Hydrafacials throughout the year just to help really keep your skin in tip-top shape. Here are some examples of same-day treatment options. We can do Hydrafacials the same day as injections. The Hydrafacial will just need to be scheduled first. We can do microneedling, BBL, chemical peels all the same day as injections as well, but again, those treatments need to be scheduled before the injection. Bbl and Halo are also treatments that you can pair the same day if you're an appropriate candidate. Typically, we will do your BBL first, followed by your Halo treatment. Hopefully this was helpful in helping you determine a really good schedule for you and scheduling your aesthetic treatments to reach your goals. If you want more tips and tricks, head to our website. You can learn more and follow us on Instagram.